Uh, Really easy question related to immunology. What translocation does this patient have? So really just a conceptual question. 60-year-old man comes to the office due to fatigue and easy bruising. He has no lymphadenopathy on physical examination. Lab results are as follows. BBC hemoglobin is low, 8.0. Platelets very low, 40,000. Leukocytes are increased. They're supposed the maximum is supposed to be 11,000, and over here it's twice that, so 22,000. Histopathology of the peripheral blood smear shows purple red needle-like structures within the cytoplasm of myeloid cells. So this is very pathognomonic for AML or acute myeloid leukemia. These purple red needle-like structures within the cytoplasm of myeloid cells are fused lysosomes containing myeloperoxidase, also known as our rods. Um, and AML in general is associated with the translocation of T1517. So T1517, that's the correct answer. Um, and it usually affects people, males ages 15 to 30, but it can step one would show questions that would most likely disregard that age range. So a lot of patients even in clinical practice would have you know ages exceeding the 30-year limit. So AML, a couple of things related to AML, which is our answer choice. A is that the disease begins in the bone marrow. It affects neutrophils, monocytes, and macrophages. It also has a worse prognosis than acute lymphoblastic leukemia, which is ALL. Of course, our rods are present, as I said before. It stains with Sudan black, so it's Sudan black positive. Translocation is 1517. It can be treated with vitamin A, since vitamin A goes to the retinoic receptor. Uh, and as I said before, it's more common in 15 to 30-year olds, but hey, it's possible in a 60-year-old man as well. The second answer choice, 922, that's CML or chronic myeloid leukemia. That CML starts in the periphery, unlike AML, which starts in the bone marrow. CML has high neutrophils, monocytes, and macrophages. They would occasionally say that the peripheral blood smears shows a motley mix appearance. Um, it's more common in women 30 to 50 years old. The is the genetic translocation is 922, which causes the formation of the Philadelphia chromosome. Um, and that's all for CML. Next answer choice is T1114. Uh, that's that's uh, uh, that's chronic lymphocytic leukemia, CLL. So CLL is a very slow growing leukemia. It also starts in peripheries. So both chronic myeloid leukemia, which is 922, and um, chronic leuc and chronic lymphoblastic leukemia, both of them begin in the periphery. Few things chronic about CLL that they have mature lymphocytes that still function. CLL mostly is very asymptomatic, so you wouldn't really know. And you should always treat it when rebel cell count goes more than 100,000. A couple of things that are very pathognomonic are the presence of smudge cells and the translocation 1114 itself. So those two things are pretty like are the buzzwords for CLL. CLL can be treated with alkylating agents like chlorambucil. That's like the test taker's favorite. alkylating agent for CLL. Next is D, which is translocation 1221. That's ALL, acute lymphoblastic leukemia. So unlike the C's, the CML, the CLLs, the AML and ALL, both of them start in bone marrow. The translocation 1221 is very pathognomonic for ALL. Mostly B cell, 98% of the time is a B cell leukemia. Patients are prone to bacterial infections, both pulmonary and UTIs, since you have a lot of immature lymphoblasts, so you cannot activate your humoral immunity, which is why you're prone to bacterial infections. Um, ALL is also positive for DDT, terminal deoxynucleotide positive, and is also pass staining positive. It is also CALA positive, CALLA positive. It's mostly common in children 2 to 15 years old, and it can be treated with the anti-metabolite like methotrexate. So yeah, you can use methotrexate for ALL. Um, Option E is T1419, so that's follicular lymphoma. That's very pathognomonic for follicular lymphoma. With follicular lymphoma, you would most likely see some type of lymphadenopathy or maybe even some mass in the cervical region. The last answer choice is translocation 814, and that's Burkitt's lymphoma. You would definitely see the B cell symptoms like, fatigue, night sweats, and perhaps even a fever. The Apart from 814, Burkitt lymphoma also has the c-MYC translocation as well. So if it says c-MYC, a translocation 814, or or a starry sky appearance on histopathology, all of that is very pathognomonic for Burkitt's lymphoma. Burkitt's lymphoma is also associated with an EBV infection. EBV infection, which is a DNA virus, is also associated with nasopharyngeal carcinoma, primary CNS lymphoma, specifically in HIV patients, and is also associated with Burkitt's lymphoma as well. Um, EBV is heterophile antibody positive, unlike CME, which is heterophile antibody negative. EBV also um, is an HHV4 infection versus CMV, which is HHV5, and that's it.